Howdy, folks. Welcome to the Squeaky Wheel. This is podcast number 2. My name is Captain Ross Pambrin, and my co-host with me today, as always, is Mr. Lawrence Gervais. Lawrence, tell us a little bit about yourself.
I'm Lawrence Gervais. I'm the regional president for the Metis Nation of Alberta, Region 3, which encompasses southern Alberta. The point where the border is just north of Red Deer, and we go all the way to the U.S. border. And yeah, that's our population's around 14,000 Metis Nation of Alberta members down here in the south, and that's who I represent.
Something that's also important, and I think I just wanted to hit on it right now, is for the folks out who are listening, and thank you to our subscribers, is we have 6 regions within this province. You are the president, obviously, of Region 3, and we also then have 6 locals underneath your regional presidency.
Yes.
So folks, my name is Ross Memphis Pambrin. Yes, I am a professional fire captain. I'm a retired RN, and that's going to play in a little bit more with our guest today. And as Lawrence may have known, I've had the opportunity to travel along with a Hall of Fame rock band, and that may not come up today, but if anything, it piques a little bit of interest for our listeners. So the focus of the Squeaky Wheel, folks, is that we talk about, our format is, Lawrence and I will talk just about one of our local coffee shops. We will hit on the things that we talked about in the previous week, which it being our first one, this is our first chance to review some of that. Some of the current issues definitely that are occurring within our province, within our region. We're going to hit on Métis connections, how to connect with us, and what to expect in the future broadcasts. And I can guarantee if we don't have time to talk to Lawrence about everything that's in his room, at some point we're going to get to it because I see you've made some changes. And then we'll also have our latest review and rant. And I think in our sort of conversation beforehand, we got a pretty good one, I think, that you're all going to enjoy. So Lawrence, just to bring you up to speed with who we're sampling today, is we are having coffee from the Heritage Coffee Roasters in Inglewood Ramsey. Now, another artisanal coffee group. And the reason that these guys are a little bit close to my heart is, you may be unaware, but the 2 owners were wildland firefighters. So they have just the most beautiful place in one of the old brick buildings, just I think it's along 11th in Inglewood and Ramsey. And folks, I highly recommend that you get there. Oh, they brew a mean cup of coffee, which thank you as well, Lawrence, for this generous mug. Folks, this is this the provincial Métis mug, or is this just regional?
It's just a Métis mug we purchased. There's no real, I mean, the provincial sash for the francophones follow that color, but it's not a francophone mug, it's a Métis mug.
Right, and I can see definitely all of the different colors that are on there. So so moving on into what happened previously. So last week we were drinking the 521 roasters. We talked a little bit about the challenges within our community right now as a result of the pandemic. I'm going to come back to the Squeaky Wheel. We talked about our website, which, as you can see up above, folks, make sure you go to www.metis3.org. And we talked and ranted about the challenges of almost what used to be something as simple as going into a grocery store. But I wanted to point out something I did, Lawrence, on our behalf, was I researched the Squeaky Wheel. Now, my question to you last week, which you pretty much did answer correct, of why we go in a circle, in a clockwise circle, when we have our meetings for everybody to have the conversation. And this article I read from the U.S. National Library of Medicine in the National Institute of Health, 2014, the Permanente Journal, which was regarding introducing healing circles and talking circles into primary care, because a wheel goes in a circular motion. And as we sit in a circular motion, or sit in a circular pattern, we are less, there's nobody who can be more assertive, because you're not sitting across from each other, you're sitting in a circle. And as you work around, everybody gets the opportunity to talk. And we move forward, and I think that's what you had mentioned. We move forward in a positive way, and we move forward like the wheel would move forward in a clockwise motion. So I just wanted to hit a few spots on where that came up.
I mean, as long as it follows the natural law of movement, and I'm sure natural law is mentioned in that article.
Yes.
Um, and then also talking about the medicine wheel and all those aspects of healing and where we go forward. And yeah, I mean, it is clockwise and not counter. I mean,
And
so
actually something I really liked about one of the terms that was in there was non-hierarchical. Because even when you are sitting in a meeting, and I see it all the time, you might be chairing the meeting, but you provide everybody the opportunity to speak. And I think that's definitely one of your strengths, is allowing that everybody to be a part of that conversation. So
yeah, I mean, I think we're all leaders in training. I mean, doesn't matter who you are, you're contributing to the Métis Nation. If you're youth, you got a voice, and we should be able to ask you questions. And the same as me, we're all on the same path together, right? And that's the whole point.
And which is a nice thing about especially our office and our community, is that everybody's available. And as I've mentioned in our previous podcast, that Lawrence is always available for a coffee, barring a pandemic. Outside of that, I tend to think you fit in quite well for meeting up with people. So our current issue that I wanted to hit on to today, which is going to lead very nicely into our guest, folks, who's joining us today, who will be coming on shortly. Her name is Reagan Bartel. She's an RN up in Edmonton, and she's the Director of Health for the MNA. Now, I'll talk to her a little bit afterwards about some of the pins and why I'm wearing them. And as I mentioned before, there is a little bit of a history of being a registered nurse myself. So can you give us a little bit of, in our current issues, Lawrence, and I'm hoping that we're going to get Regan to talk a little bit about it, mental health in the Métis community?
Well, I mean, some of the issues, of mental health in our community is, where we're headed as a Métis nation. Identity is such a big conversation piece within the Métis community about who you are, because we're not born into our status cards. We're not born into, some of us aren't born into the Métis nation. So how do you get all that stuff back and knowing who you are, which is all about mental health? If you follow that circular pattern and medicine wheel, you need to really know who you are to actually get to that healing place. And the more conversation we have from elders to ourselves about our families, our family units, the way our parents lived, the way our grandparents lived, then we sort of we follow that route of what our ancestors were. And hopefully we get a lot of knowledge and we take back what they did to actually survive on this planet for this long until they were carried away. So,
and that's excellent. I think that's a message that we all have to understand. And for me, in my own case, my father being an Aboriginal veteran, and that was the still a fairly common term that they're sort of reevaluating. It was I'll have to have a conversation with him and maybe even have him on as a guest. The challenges of coming out of the military at the time and what the allowances were. And he's been out of the military, I think, for 20 years, but it was around that time that he really started to embrace a bit more of his identity, because he felt he lost quite a bit of that identity when he was in the military, which is no slight against the military. We're still all learning about culture and identity. And the point I wanted to make was that when I discovered at that time, 20 or 25 years ago, that it was important to him, that he wanted to understand a bit more about his identity, I knew that was going to be important to me someday. And this is another community in which we identify with each other, and it's one more strength. And I think that's the reason our conversations are important. And that's why I'm excited to have Regan on today, because hopefully she can help us and help me understand and bridge some of the gaps that are occurring within the provincial community and our regional community when it comes to health.
mm-hmm. Yeah, I mean, we only get to a place, and I know your dad quite well, and he told me one story about him playing hockey for the military and him having breed on the back of his jersey, right?
Yeah.
And
Yeah.
that was just, who he was, and that was his identity. But, for him to move away, and I'm sure in the 60s in the military, it was quite strong that, you're one solid unit and you don't bring culture into the whole mix. And a
Absolutely.
lot of things have changed, of course, with the military. So, I mean, my brother's an RCMP who's an Indigenous officer who, was in an Indigenous division that was graduated during that time in the RCMP for the first time ever that they graduated about 25, I think, members at that time. So the whole context of military is kind of changing and rapidly. So
Yeah. Can you, and I think that's going to be a great conversation we're going to have, in the future here, just regarding that, under a bit of a better understanding of identity. But why don't you talk a little bit about Métis Fest? And I think we're going to be seeing Reagan join our conversation here any minute now.
Yeah, I mean, Metis Fest it's going to be virtual this year. It's our second one. It's going to be really different for us, but I think there's going to be a lot of viewers because Métis people like to gather, like their families like to gather together, and without Batoche, without all these other events, it's just formidable that a lot of people are probably going to tune into the virtual Métis Fest and see what that is. So there's a jigging contest. There's a showcase between artists between each region. I think there's 5 that are chosen. And then we have about 45 minutes in the whole package. I have about 6 hours. And hopefully Region 3 has a strong voice and good talent and good jiggers that show up. And everything's on June 13th.
Everything's on June 13th, and I think that's one of the most important things. And folks, if you look up there, you'll see just above us where it indicates that it is June 13th. And now, Lawrence, I don't want to interrupt you, but somebody wonderful and charming who's close to my heart has just arrived. Folks, this is Miss Reagan Bartel. She is the Director of Health for the MNA for our province, and dear to my heart because both of us have a background as registered nurses, as well as a commonality. And just to show you, I'm wearing both my Royal Alex Senior pin. You only got one of those when you went to the School of Nursing there. And I'm wearing my registered nurse pin. So welcome, Reagan. Thank you for sharing your time here with the Squeaky Wheel.
Well, thanks for having me, guys. I'm excited to be here.
Now, tell us a little bit about yourself.
Yeah, for sure. So as you said, my name is Reagan. I've been a registered nurse for the last 16 years and spent most of my career at the Royal Alex Hospital in the intensive care in Edmonton, loving every second of it, but decided to make a transition into public health to see if I could make some more systemic changes instead of just putting Band-Aids on things. So that's kind of what motivated me to go back to school for my master's degree. And then I am a proud Métis woman, born and raised in BC, but relocated to Alberta when I turned 18. And so I'm a proud member of the Métis Nation of Alberta, living and residing in Region 4. So that's a little bit about myself. I'm married. I am a happy mother of 2 fur children. I don't have any children of my own, but I am a great auntie. My nephew and my sister actually reside in Region 3. So Region 3 is very dear to my heart. And I travel there often. So you can find me in Okotoks if I'm not in Edmonton.
That's right. That's funny you'd mentioned that because I've been meaning to try and get you or to hook up for coffee because I pop up to Edmonton every now and then because I have family up in the Edmonton region. So
that's Métis folks. We travel around, right?
We're always on the move.
Yeah.
So we were just talking, Reagan, about mental health.
Right.
Within our community, within our province. Can you share with us some of the programs that are happening?
Yeah, I can share some of the exciting things that are coming and what we're working on, Ross, because there is things that we are continually working on. So right now, the Métis Nation of Alberta offers a navigation service. And so anyone that phones our head office, the number is 455-2200, is able to request to be put through to our supports and services navigator. And that lovely lovely person will be able to try to connect you with external resources, because we all know that sometimes we just need that friendly voice to guide us to where we need to be. So we do have somebody within the nation that contributes to that. We also have access to all of the provincial supports that have been put in place. Whatever you may think of any sort of government level, they've actually done a really great job of bolstering the Kids Help Phone, the Mental Health and Addictions line. There have been some new supports and services that have been put in place. And so connecting with the MNA Supports and Services Navigator is one of the easiest ways to hear about that entire spectrum. Within the MNA Health Department, and definitely supported by leadership like Lauren's, we're working on obtaining grants in order to be able to provide some more robust mental health services. That includes boosting navigation to existing resources, but also looking to see if we can try to obtain some exclusive services such as counseling for our community. The reality is that everybody is certainly impacted by the pandemic. Social isolation is huge for our community that relies so heavily on kinship ties and getting together and building those relationships and celebrating our identity as Métis people. The pandemic has hit us really hard. And so I think that I would be amiss if I didn't actually recognize all the cultural programming that the MNA is putting online as an actual mental health support. A big shout out to our MNA youth team. They have been providing things like Michif words of the day. So learning our language that is lost, is bolstering our community's mental health. Things like Métis Fest, which I came in at the tail end of that conversation, but Métis Fest is more than just jigging. It's more than just getting to see amazing Métis artists. What it is it's bringing us closer together even though we're far apart. And those connections are all really incredible links to our mental health. The other really important thing that I think should be recognized is that often our mental health suffers when we can't meet our basic needs. And especially, I'd like to give a shout out to Region 3. I mean, all of the regions have their own supports, but I know that Region 3 is also supporting those basic needs through their programming. And I think that by meeting those basic needs, by being able to help, even just in a small way, we're bolstering the mental health of our community. So I'm actually really proud of what the Métis Nation has done in order to meet those basic needs, but also think outside the box and recognize that, you know, culture is an important part of who we are and actually grounds us and brings us back to that, even if we can't be in the same room dancing. Online kitchen parties have been popping up across the regions. Our communications team is doing a great job of linking all of those. So I know that you guys have stuff on your website, but the MNA provincial office also has things on their website. So that's one of the amazing things that we are learning from this pandemic, is how to support our mental health when we can't actually get together. So I definitely hope that people tune into Métis Fest, because it really is more than just seeing some cool dancing. It links us and it ties us together, and that actually does improve our mental health.
Lawrence, what do you know that's happening about some of the other aspects of Métis Week? Because what other commitments are we trying to make when it comes to the provincial commitment?
You know, Métis Fest is important because, you know, I remember last year we had it downtown, and the amount of advertising we did, and the amount of people that showed up was just immense. And we wanted to continue that sort of movement headed forward, but because of COVID, we'll all have to stay home. But we also want to, you know, showcase our artists, number one, because a lot of them aren't getting gigs right now. And that's part of it too. And supporting them, you know, that's the main thing. And then also our jiggers too, because they depend on events too, for their income over the summer too. So, you know, we just want to make sure that everybody full circle is taken care of as much as possible, especially around Métis Fest. And really, at the end of the day, we have enough programming for 2 or 3 days, but you know, that's the life we live in. And this is the first event, and hopefully we get another one by the end of the summer. Wouldn't that be nice?
Absolutely. Hopefully we can fit one in sometime. And I think it's important that and this is a great part of the conversation right here, is that now we extend that conversation to make sure both our elders, our seniors, as well as the youth become aware. I'd read a great article recently about how the seniors who fought so hard to try and avoid using any kind of banking online, working within the computer world, their attention to that requirement has gone up 80%. So if they've gone up 80% in order to just do some online banking, hopefully we start to find them looking for Métis Fest online as well. So Reagan, because we do only have so much time for our show, which I know Lawrence would like to try and make this 3 to 4 hours long, but we try to keep it around the 30-minute mark. Can you talk a little bit about the importance of testing that's happening in our province right now, and how does that reflect epidemiology? Because we did have a subscriber who wrote in, Heather had asked a question regarding how are we monitoring the different cultures? How are we monitoring specifically our Indigenous population regarding people who have been exposed, people who have had infections, people who have recovered? Can you talk a little bit about that? I apologize. There's 3 things I was throwing at you at the same time, but testing, epidemiology, and then yes, how we keep track of that.
Yeah, for sure. And thank you, Heather, for the question. I think that's a really great question. I'll preface it with, I am not Dr. Dina Henshaw, so I'm not the Chief Medical Officer. I do have some training in epidemiology, but it's very minimal. So I'll do my best to answer your question, and I'll apologize in advance if I miss anything. And definitely you can hold me accountable if I say something incorrect. I'm definitely open to that. So understanding where a disease or a virus like coronavirus comes from, how it spreads, and what communities it affects is basically the biggest part of epidemiological surveillance. So understanding how it moves within a population. So testing is important. Testing is one of the only ways that we will gather that information. It traces the spread of a virus. It helps us work to see which measures that we've implemented in terms of public health. So for example, shutting down businesses, was that effective? Getting tested gives us that information. It helps inform decisions about where financial aid is given, where other basic supports are given, by simply looking at the communities that are impacted. And a really great example of that is actually what was going on in your region, guys, because Region 3 was hit very, very hard. And so they increased the amount of testing so that we would understand better how it was moving within your population. So we are luckily at a point where we've all done that work, and we're still asking for symptomatic people to get tested so that we have that picture and we can stop the spread. But now we're at a point where we want to have kind of a broader population health surveillance. And so they're asking for asymptomatic folks to be tested. And I would really encourage our Métis folks to get on board with that. And I think that Heather's point is very true. I think that Indigenous people do need to be counted, but it needs to be done in a way that is respectful to the community. And so I think what people need to recognize is that, especially through the MNA, we're very fortunate in that we have a confidential way to look at that information through our information sharing agreement that was created way back in 2010. And so if you do decide to go get tested as a Métis Albertan, we are able to link that information and have it. We don't share it with anywhere. We don't actually even want the government to have it. We just know that we can access that information so that leaders like Lawrence have the ability to say, okay, we had this many Métis folks who were impacted. This was the greatest area. If a second wave comes, or heaven forbid we have something that happens like this in the future, people like Lawrence and myself as Director of Health can use that information to target what our response will be. So the biggest thing for testing and why we need to have it happen is because it does give us direction. It's not just a number, we actually care. And you don't need to identify yourself or your community in order to be tested. Information is transmitted, confidentiality is maintained, and it's not shared anywhere. So I would highly encourage folks to get out and get tested. It's a really simple process. I think Lawrence has actually gone, haven't you, Lawrence?
Yeah, I actually went this morning and got it done. So it was a very easy experience up until you get the swab put in your face, and she goes open wide and stick out your tongue, and then the 5 seconds of just gagging. I think that was a mute point, and it took me about 30 seconds after the drive away to go, okay, well, I was a little bit violated there, but at least I got a test done, and my
And
day went on just regular.
yeah, and you know what, Lawrence, your testing is so important, right? It tells us, you know, I mean, you and everybody else who gets tested, it allows public health people to catch if there's any people who might be spreading symptoms without even recognizing that they're carrying the virus. And that's really important. And that is something that I think our Métis community does really well. We take care of each other. And so I think that the opportunity, and I list it as an opportunity. I know people most of the time don't think as health interventions as an opportunity. But if you look globally, Alberta is one of the only places that has the testing capacity to be able to offer this. And actually, the Métis Nation is one of the only Indigenous communities that has an information sharing agreement, which allows us to actually have control over our own data, which is absolutely massive. There are a lot of people that are still trying to negotiate those things. And so, Heather, absolutely, we should be counted and we can be counted. It just is a matter of going online and booking that self-test. And as Lawrence said, you get a little bit of a gag reflex, but the payoff for that is massive, because if there is a gap, then what you've done is you've given Lawrence that information to advocate for us and say, guys, we have a problem. We know we have a problem because we have those test results, and we can move to fix it. So that's why testing is so critical in terms of the epidemiology, the spread of this particular disease.
The difficulty, I think, for us at this time right now is when you have the director of health online, we could talk for hours. I think what we've hit on, folks, and the message we really want to send is, go get tested. Now is your opportunity. If you have any symptoms. But my rant, because as we slowly move into that, and I know, Lawrence, that you have some acknowledgments you wanted to make, but we still see a lot of people who, even though the province is relenting a little and saying, okay, you can sort of get 50 people together, folks, it's still okay to stay 2 meters apart. Wear your masks when it's required, do your part, because that is going to continue to help to stop the spread. And hopefully our jobs will all get a little easier when it comes to that. Reagan, is there anything specific you'd like to hit on for your last couple notes here?
My last couple notes is essentially just how absolutely proud I am of how our community has stepped up to take care of each other. Before you get into a rant, let's celebrate those 6 months. I am in a fortunate position. I mean, all the angry phone calls go to Lawrence, so I don't get any of that. I am in the fortunate position of hearing and celebrating a lot of the successes that come my way. So I have heard of youth who know that an elder in their community really enjoys fiddle music, but doesn't have a cell phone, doesn't know how to handle a cell phone. So I've heard of them showing up to somebody's front step, staying that 2 meters back, and playing a fiddle, like a live kitchen party. I've heard that. I've seen people pay out of pocket for groceries to help people in the community, knowing they may not get it back, but you know what? It's the right thing to do. I've had people volunteer to go pick up groceries for people who are feeling sick and are doing the right thing by staying home. I've seen people cancel major events, celebrations of 90th birthdays, because it was the right thing to do to protect their community. And so I think that the biggest take-home message is we need to keep doing what we're doing. We need to keep looking out for each other. We need to keep reaching out and asking when we need help and doing all the right things, because we're going to make it through on the other side. And you know what? Métis folks are so resilient. We're going to come out even stronger than we were before. We might have a couple moths in our pockets from, the economic downturn, but we are going to be okay. And we're okay because we do it together. And so that, I think, is my take-home message.
Well, Faye, that was absolutely fantastic. I honestly don't think there's much I need to rant about. I wanted to make a comment about those people. It's okay, folks, to still do your part.
In
Yeah.
fact, you should do your part.
And please
Absolutely.
do your part. Now, I'm not going to let you leave. Regan. You're going to have to just stay to the end anyways. Lawrence, you had some acknowledgments you wanted to make.
Well, first of all, I want to thank Regan for coming on. You know, she's been valuable to the nation, especially through this last 3 months. You know, we get updates from her quite a bit, even before or even simultaneously to Dr. Hinshaw's sort of announcements too. And we're very, very lucky that we get that information right after she's done her speech. And I also want to thank her too for my parents being in a Métis Seniors Lodge on Saskatchewan side in Lloyd, and Regan checking in on them to see how they were doing. So she does do cross border if we just ask her, and no, I want to thank Regan for that. What I wanted to cover was you know a little bit of our rants, acknowledging leaders of the past, and it's so important that we do this. And because of my work in the downtown east side in Vancouver for so many years, I did come across individuals that take our national issues to the forefront. And Dave Dennis, for us, especially in the Vancouver community, are kind of mourning right now his passing. And I just wanted to send an acknowledgement to him and his family and all those people out there that work tirelessly for the Indigenous communities, not only just Métis, but First Nations, Métis, and Inuit, bringing their issues forward. So I just wanted to acknowledge him as a leader, and knowing even for me as a youth council member in the past, working in Vancouver, that he was the most eloquent speech person that I've ever met. And he could rally the troops within 2 or 3 minutes. And nobody has that quality that I ever met. So it's a very big loss for that community over there. So I just wanted to bring that up. In terms of acknowledging 2 people, I've done Regan and I've done Dave Dennis, and now it's Ross's turn.
Well, I know we're wrapping up here right away, so I just wanted to say yes, thank you, Regan. Thank you to our time. That though we didn't share it together on the ICU at the Royal Alex, it's a common bond. Yes, I also wanted to say thank you to for the allowance to be used on our traditional lands, our connection with Mother Earth, our elders, our seniors. Thank you to my co-host. Yes, let's keep the fire burning. Thank you to all our subscribers out there in Radio Land. If you want to reach out to us at any time, you can look up on the screen there, tsw@metis3.org. And Lawrence, thank you again always for your time, for sharing for this podcast. And
to all the viewers, sorry, we got to make sure and emphasize, subscribe to the channel, please.
Subscribe to the channel.
Yes.
And
Regan will be back, I can guarantee.
Yes,
I think she has more to say.
There'll be a lot.
I've got lots of stories. I'm also the camp nurse, guys.
I
can tell you stories for days.
So thank you all for this opportunity, and I appreciate your time on our podcast, Regan.